Understanding psychological disorders is crucial for fostering empathy, reducing stigma, and promoting mental health awareness. In this speech, I will provide concise explanations and examples of some common psychological disorders. 1. Anxiety disorders. Anxiety disorders are characterized by excessive fear and worry that interfere with daily life. They include conditions such as generalized anxiety disorder, GAD, panic disorder, and social anxiety disorder. Generalized anxiety disorder, GAD. People with GAD experience chronic and exaggerated worry about various aspects of life, even when there is little or no reason to worry. For example, someone with GAD might constantly worry about their job, health, or family, even if everything is fine. Panic disorder. This disorder involves sudden and recurrent panic attacks, which are intense periods of fear and discomfort. A person might feel like they are having a heart attack, with symptoms like chest pain, palpitations, and shortness of breath. Social anxiety disorder. Individuals with this disorder have an intense fear of social situations where they might be judged or embarrassed. For instance, a person with social anxiety may avoid public speaking or attending parties due to fear of being scrutinized by others. 2. Mood disorders. Mood disorders primarily involve disturbances in a person's emotional state, leading to periods of extreme happiness, sadness, or both. Major depressive disorder and bipolar disorder are notable examples. Major depressive disorder, MDD, also known as depression. This disorder is characterized by persistent feelings of sadness, hopelessness, and a lack of interest in activities once enjoyed. An example is someone who loses interest in hobbies, withdraws from social interactions, and struggles with daily tasks. Bipolar disorder. This condition involves alternating periods of depression and mania. During manic episodes, individuals may feel euphoric, have inflated self-esteem, and engage in risky behaviors. For example, a person with bipolar disorder might go on spending sprees, make impulsive decisions, or feel unusually energetic for extended periods. 3. Obsessive-compulsive and related disorders. These disorders involve repetitive, unwanted thoughts, obsessions, and behaviors, compulsions, that individuals feel driven to perform. Obsessive-compulsive disorder, OCD. People with OCD experience intrusive thoughts that cause anxiety and engage in repetitive behaviors to reduce that anxiety. For example, someone with OCD might obsess about germs and repeatedly wash their hands to the point where it interferes with their daily life. Body dysmorphic disorder, BDD. This disorder involves an obsessive focus on perceived flaws or defects in one's physical appearance. For instance, a person with BDD might spend hours each day checking mirrors, grooming, or seeking reassurance about their appearance. 4. Schizophrenia spectrum and other psychotic disorders. These disorders are characterized by disruptions in thinking, perception, and behavior, often including psychosis, which is a loss of contact with reality. Schizophrenia. This severe mental disorder involves symptoms such as hallucinations, hearing or seeing things that aren't there, delusions, false beliefs, and disorganized thinking. For example, a person with schizophrenia might believe they have special powers or hear voices giving them commands. Delusional disorder. Individuals with this disorder have persistent delusions, which are false beliefs that are not based in reality. Unlike schizophrenia, these individuals do not have significant impairments in other areas of functioning. An example is someone who firmly believes they are being followed or persecuted without any evidence. 5. Eating disorders. Eating disorders involve preoccupation with food, body weight, and shape, leading to unhealthy eating behaviors. Anorexia nervosa. This disorder is characterized by an intense fear of gaining weight and a distorted body image, leading to extreme restriction of food intake and severe weight loss. For instance, a person with anorexia might refuse to eat certain foods and exercise excessively to lose weight. Bulimia nervosa. Individuals with this disorder engage in binge eating followed by purging behaviors, such as vomiting or using laxatives, to prevent weight gain. An example is someone who eats large amounts of food in a short period and then induces vomiting to compensate for the binge. 6. Post-traumatic stress disorder, PTSD. PTSD can develop after experiencing or witnessing a traumatic event, such as a natural disaster, serious accident, or assault. Post-traumatic stress disorder. Symptoms include flashbacks, nightmares, severe anxiety, and uncontrollable thoughts about the event. For instance, a military veteran with PTSD might have vivid flashbacks of combat and avoid situations that remind them of their trauma. Understanding psychological disorders is essential for creating a compassionate and supportive society. By learning about these conditions and their impact on individuals' lives, we can promote mental health awareness, reduce stigma, and encourage those affected to seek help. Remember, mental health is just as important as physical health, and we all have a role to play in supporting each other on this journey. Thank you for listening. Nathaniel.